Hello out there in television land. Welcome to It's Your Health.
You remembered.
2023. And imitation is the greatest form of flattery. And this show is going to be dedicated to women. And of course, Samsung Production has The Girls, which of course features Janine Lasant and Debbie Lasant.
And Sammy's wife?
Correct. So we're going to have, except for the headlines, features about women's and women's health.
Okay.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health.
But first, he's going to tell you to check with your doctor.
Before doing any of the things that we talk about here on It's Your Health. Thank you. That's why I bring her along.
Yeah.
Welcome to the first segment of It's Your Health. I'm with my bride.
And we have, first of all, to say thank you. We got so many Christmas cards and notes, and it meant so much to us. So we want to thank everyone who was kind enough to do that over the holidays. And we have a special thank you because one of the cards knocked our socks off. If you watch Yellowstone, and I thought everybody did, you have seen Rip and Beth. They are a couple that has gotten married and they're madly in love. And anyway, they write on the card, "You're our favorite couple, along with Rip and Beth." So we figure we're pretty high up if we can.
That was
he's
terrific.
Comparing us
Right.
with them, yeah.
Thank you out there, Dave. And as a matter of fact, again, since we're talking about women's health, protection is part of women's health as well. And one of the things that we discovered was this, what's called Pepper Blaster 2, which is available at Dave's gun shop.
In drums.
Right, and it's not pepper spray, but it's a superior, less lethal protection that shoots out a concentrated jet spray of a toxic substance that would sort of immobilize someone for a while at 13 feet at 112 miles per hour. So take a look at that. Mother's Day is coming up, so
I think I'm going to carry that with me when I go for walks.
well, it wouldn't be a bad idea. There's 2 shots in that particular instance. But
Okay.
moving right along.
Okay, shall we start our headlines?
Please do.
I will. Home sleep apnea testing for the diagnosis of obstructive sleep apnea. Obstructive sleep apnea, OSA, affects approximately 17% of women and 34% of men in the United States. It's diagnosed with a sleep study. Most can be performed at home.
Well, obstructive sleep apnea, we've preached about it before, is a sort of sleeper diagnosis. Most people don't come in and say, I have this, because they don't know about it, because they're sleeping. If you have a neck circumference of 17 inches or more, and your partner says you snore, then it's likely you have this. Going to a lab and having the test done is very cumbersome, especially during COVID. So they now do home sleep testing, which is fairly accurate, is what this study was saying. So next time you see your healthcare provider, inquire about getting tested for sleep apnea.
They're pretty accurate home tests, and they're less expensive also. Okay, next headline. Statins boost glycemia slightly, but CVD benefits prevail. Okay, I'm lost. What are statins? What's glycemia? And what's CVD?
Okay, well, we give statins, such as Lipitor, to lower one's cholesterol. Some people don't like to take them because of muscle aches or pains, and it can raise your glucose a little bit. But the advantages of lowering your cholesterol far outweigh if your sugar goes up a little bit. So that's what this article was saying. So we should really need to push the statins to push down your cholesterol.
What is CVD?
A cardiovascular disease.
Okay, let's go to the next one. physical activity and the prevention of depression. Can physical activity prevent the development of depression? Yes. It appears to be associated with a lower risk of developing depression and depressive symptoms.
Right, and that's why when we see our elderly patients, particularly be snowbirds and go down into a warmer climate for winter, they do very well because they're outside all the time, walking and playing pickleball and whatever. And we get into a depressive time up here because it's darker earlier, darker longer, a little colder, you can't get out and exercise. But exercise is probably your best medicine.
And there was a study done, and they found out that people who exercised, there was a less incidence of depression.
Correct. So get out there.
Okay, I'll get out there with you. Okay. And the dog. We'll all get out there. Okay. You're going to talk about a bunch of things now, right?
Correct.
Okay, these are health issues that are specific to women's health.
Okay, health issues specific to women's health. Number one is heart disease. 1 in every 4 deaths among women. So again, we often don't think of women as having or dying from heart disease, but you got to get that taken care of.
And the symptoms are different often than symptoms of men.
Correct. They may not get the chest pain going up to the arm and things like that. They may just feel lightheaded, dizzy. Something's not quite right. Breast cancer. And again, this is the most aggressive cancer among the global female population. So you need to get yourself breast exams, get your mammograms, and keep that up to date.
I would like to mention that Janine just had a post on Facebook saying that she just got hers, her mammogram, and that everybody needs to do it.
No doubt, no doubt. Keeping that going, the next step is don't forget your GYN health. Ovarian and cervical cancers are up there, and everyone should, like their car, get inspected once a year. Women should get their annual GYN exams. Pregnancy issues. Pre-existing conditions can often get worse, such as hypertension or sugar issues can get worse during pregnancy. You have to be watched very carefully. Of course, one of the big things that we see is depression and anxiety. Very perversive and underdiagnosed and undertreated. Some people are ashamed to admit that they have anxiety or depression issues. Particularly, it gets magnified if you're going perimenopausal or even the menopause itself. And let's face it, it's a darker world out there than yesteryear. So these are things that need to be addressed and should be addressed on a timely basis.
Okay, well, I'm going to bring this up because I'm very curious. You are a doctor, a medical doctor. Why your doctor is wrong about thyroid testing. 1 in 5 women age 60 and older has some form of thyroid problem.
Well, we go by what's called the TSH, and if the TSH is normal, then we say, well, you don't have a thyroid problem.
But that's not necessarily true.
It's not. Particularly the reason we would do it is because of weight gain, feeling tired and weak, maybe depressed. And what we really need to do is to add on free T4 and what's called a T3.
T3, yep.
And that will help to hone in on do you or do you not have a thyroid condition. And if you have a mildly elevated TSH and you're having symptoms, that really should be treated unless there's a reason not to.
I never realized until we started doing our show and I started having problems that the thyroid plays such a big part in our lives and in our health. It really does.
It's basically the battery of your body.
And on that, we will keep our batteries going for the next section.
Don't change that channel out there in television land. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back, and please call and support and tell the sponsors you heard it on It's Your Health. Welcome back to the second segment of It's Your Health. Philip Benyo with his bride, confidant, cheerleader. a psychologist. What else?
That's about it.
All right, that's enough.
Assistant. Ready to start with headlines?
I am ready when you are.
Okay. The first one is a question. Does my patient need to be screened or treated for a urinary tract infection? Patients with symptoms consistent with urinary tract infections, that's called a UTI, do not need to be tested and only need to be treated.
To some degree, that's true. If you're out there and you're having frequency burning and when you're urinating and you say, listen, I know this is a urinary tract infection, it could actually delay your treatment by going for a urinalysis, finding out your culture. I think it's sometimes better just to treat you for the short term and see how that works. I think you would need further evaluation for persistent or worsening symptoms.
And these are ones who should be screened. Pregnant women, healthy non-pregnant women, patients in long-term care, patients with diabetes, and older patients with an altered medical state.
Yes, that's particularly in the geriatric world, when we see a change in mental status, we think they must have a UTI.
That is so strange.
Yeah, it is odd, but
it is.
It happens.
Okay, another question. What is pulmonary embolism? A PE is usually caused by a blood clot that forms in a vein and travels through the bloodstream to the lungs. It affects approximately 370,000 people.
Right, and we're seeing more of it because if you have COVID, that has been shown to change your coagulation and ability to form blood clots. So if you are out there and you have some swollen legs and all of a sudden you experience chest pain, shortness of breath, chest pain when you take a deep breath or you cough up blood, you better hightail it to the emergency room because you may be flirting with a pulmonary embolism.
And if you have a small one, you might not have any symptoms at all.
They can be sometimes silent.
Supplemental Nutrition Assistance Program. And Sammy's going to put up the website and the phone number to call. SNAP is for people who have to have a certain limited income, and they found that people on SNAP, because you're only allowed to purchase certain things, that they're healthier. They're eating better food. If you go to the website, it's wonderful. It has everything you could possibly need. It has cookbooks, it has recipes, it has suggestions for a shopping list, and you can even do your application online.
And the take-home message is if you eat better, you're going to feel better, and they've done a study showing you have slower rates of memory decline for people enrolled in the SNAP program. And the reason why is they are eating better and eating more nutritionally beneficial foods.
There's 1.88 million people on it in Pennsylvania. That's
Right.
not really a lot.
Well, we're going to get some more registered through the help of Samsung Productions.
These are the top issues for women's health. First of all, cancer. Two of the most common are breast and cervical for women. Reproductive health. Unsafe sex is a major risk factor, particularly among women and girls. Maternal health. Over the years, there have been improvements in that. So pregnancy and childbirth, it's going better than it used to be because 300,000 women used to die in childbirth or after delivery. One that surprised me is HIV. Young women bear the brunt of that because they don't expect that that's something that they're ever going to get. Sexually transmitted infections. Untreated syphilis is responsible for more than 200,000 stillbirths and early fetal births every year, and for the death of 90,000 women. This is a disease that you can prevent and keep it from happening. The next one I hate, which is violence against women. 1 in 3 women under the age of 50 have had violence against them, either emotional or sexual, and that goes along with mental health. Women more than men have a problem with mental health, with depression. Non-communicable diseases, use of tobacco, abuse of alcohol, drugs and substances, and obesity. Nearly 50% of women are overweight. Being young, girls under 20 are giving birth every year. We need to look at that. And finally, getting older. Older women have a higher risk of abuse and generally have poor health. And those are my major ones.
That's a good way to start the year.
That's for sure.
Well, going on with women's health issues, we'd probably want to slide into bone health. Is that right?
That's right. Were you just looking at my things here
I'm
to
always
see what
looking
we were
at-
doing?
I'm always looking
Is that what
at
you're
things,
doing?
yes.
Okay. Well, actually, we want to start off with something I want to know more about, the difference between osteopenia and osteoporosis.
Right. Well, once you go through menopause, of course,
Which is no fun.
you're going to end up losing some bone each year. And there are other issues that can cause bone loss, smoking, alcohol, steroid use, if you have chronic infections. And in either event, we can diagnose these conditions by doing what's called a DEXA scan, which is a scan of your spine and your hips to see how thin they are. Now, once you get bone that becomes thinner, we call that osteopenia. Okay, that means the bones are just thinner. You haven't really lost bone. That will progress to osteoporosis, which is actual bone loss. You'll probably be a little shorter than you
And
were.
that's bad.
That is bad, and somewhat can be kind of held back in terms of how fast it progresses. Sometimes actually, I can say reversible with some of the medications out there.
Wow.
So if you're shorter than you were in high school, chances are you have osteoporosis. And I would get the screening test for it, Medicare pays for it, and then look at the variety of ways of reversing it if you can, and at least slowing the spread and the quickness of bone loss.
I take a DEXA scan every other year. They are painless. They take about 5 minutes, and your doctor knows exactly what's going on with your bones from that.
Right, because fractured spines and hips, they are life-changing events, so we want to try to avoid that. But we're going to be wrapping this up for the second segment of It's Your Health. We'll be right back after
I wasn't
this
ready.
brief commercial. You always say that. All right, we'll be right back after this brief commercial message.
Okay.
Welcome back to the third and final segment. Boy, this went fast to It's Your Health.
Yeah, but winter's not going fast.
Oh, well, maybe you can tell us more about it.
Well, what are some ways that we can fight the winter blues? Warm up with seasonal foods, like pumpkin. Create a special winter ritual. For example, a nice long hot bath with candles and music. Get some morning sun. 15 minutes in the morning is really good for you. Take zinc and get cozy. I like this one. Get cozy with your puppy. I do that all the time. I can get cozy with our puppy, and he makes me feel better.
Rough, rough.
Rough, rough. Okay, so those are the ways to fight the winter blues. Sleep quality affects brain functions. Poor sleep has been shown to adversely affect learning, memory, and executive functioning.
Probably one of the biggest complaints we have in our office is I'm not sleeping. I'm having trouble getting to sleep. I'm getting trouble staying asleep. And it can affect the rest of your day, without doubt. Of course, we talked about sleep apnea earlier in the show. And you should go through the stages of sleep because sleep is the thing that will recharge your battery and your brain. So safe and effective sleep is crucial, and it's one of the biggest things that we are trying to tackle, because the treatment of it may not be any better. For example, we don't want to be giving you sleep hypnotics all the time. It increases their fall risk and may lead to cognitive issues in and of themselves. So we need to come up with better ways of getting good sleep hygiene.
Yeah, and one of the ways is not using your phone late at night. But I do that, don't I? We won't talk about that. Let's talk about this other headline. We're talking about vitamin B12. It's an essential nutrient for your body. It supports the health of nerve and blood cells and contributes to the production of DNA. You can find it in eggs, meat, poultry, fish, milk, cheese, and yogurt.
Some people don't absorb B12, by the way, which is why we do a B12 level. Crucial vitamin. In fact, all the B vitamins, B1, B6, B12, are all crucial and important for maintaining our quality of health. So if you're not feeling quite right, get your B levels checked.
Well, if you're having a problem about the vitamin B deficiency and insufficient absorption, that's because you don't have enough stomach acid to adequately take care of it.
And everyone's on these proton pump inhibitors to reduce stomach acid, so we're running into more and more issues with vitamin B12. You know, it's a cause for dementia as well. And last week, it's unbelievable. If you look for it, you'll find it. I had an 88-year-old woman who has dementia, and through all the years, no one checked her B12 levels, and there was hardly any. And so we gave her some B12 shots. And so if you don't look for it, you're not going to see it.
Mm-hmm. And if it becomes really bad, you will get tingling or numbness in your hands and feet. You'll have trouble with balance. Then you're really in trouble.
Right. It can cause nerve damage.
I've gone through menopause. So why are my hormonal systems coming back?
Well, yeah, life isn't perfect, and stress can induce changes in the stress hormones, the cortisone in our life. It can cause a thyroid imbalance. And again, I would probably get evaluated to see why your symptoms are either returning or not going away.
Thyroid and adrenal issues, and that's all I know.
Okay, that's all we all know.
Okay. Well, I'm going to talk now about understanding sexual arousal in women. Women's sexual response is much more complex than men's, and men know that. Compared to a man, a woman's sexual response is typically more influenced by emotions and thoughts. And again, it's more complex. Thoughts and emotions might influence the sexual response of a man, but not the way they do for a woman. And they play a much larger role for a woman. If you're afraid to tell your partner what you like or what feels good, you need to do that. And for some of us, we're concerned about our body image, because if you look on the internet, if you look on TV, they're all young, beautiful, skinny women. And that sometimes makes a woman feel pressure when it comes to doing something. Women's perception of their attractiveness correlates with her ability to feel sexual desire, excitement, and orgasm. Poor body image fosters low arousal. Decline in the hormones, testosterone and DHEA, can affect arousal, excitement, and orgasm. It reduces vaginal lubrication, which is something you can easily take care of, and thins the genital tissues, sometimes making intercourse painful. Lubricants come up with more fun ways to enjoy each other, are all things that can be done.
Well, we go back to Men Are From Mars, Women Are From Venus. And if you haven't read that book, I recommend it highly, not only for interpersonal relationships, but personal relationships as well. illustrates the fact that we're two different species, two different languages, two different ways of
We
communicating.
may be too different about everything, but I know that it's almost our anniversary, and I know that it's almost Valentine's Day, and I'll bet you never even thought of those two things. I have a Valentine card for you, an anniversary card. I'm going to read it to you now. Listen.
Okay, I guess I'll.
I loved you yesterday. I love you now. I always have, and I always will. Happy anniversary.
Wow, that comes more than once a year? Is that how?
You wish.
Okay. Well, what a way to end the note here. But thank you for listening to Beth here. And hopefully we informed you and entertained you. And remember to call our sponsors. Tell them you heard it on It's Your Health. And thank you for allowing us to come into your home.
Absolutely. And thank you, Sammy.
All right. See you later. Enjoy. Thank you for watching.